So in this video, we're going to talk about controlled articular rotations, or CARs for short. Now, this is something that I do every day. There's a few applications that I'll talk about today. I teach them to my patients, my clients, my family. I really urge everyone to do them every day. So the goals are really to move each of our joints through their fully available rotational range of motion, which is really important. We're going to explore our joints range of motion, or our current workspace, which means that we can use these as a daily assessment to see how our joints and our body is moving and feeling. Now, I also use them for a variety of purposes. Warming up before workouts, before jiu-jitsu, or also programming them into workouts. So if I'm working on building mobility or working through a full range of motion, we can use them at different intensities to get that desired effect. Now, going through these CARs, you need to know the idea of irradiation, meaning just creating tension through the muscles in your body. There's two parts to it. So creating tension through the entire body to stabilize all of the other joints, and then creating tension through the moving part. So if I was just going to kind of brace myself and create tension through my body here, I can do that on a scale from 0 to 100. For the morning routine, the daily routine, we're just trying to get some blood flowing, some movement going. I'm going to do this at an intensity of about 20 to 30%. So I'll do that through the whole body. If the shoulder is what we're starting with, then I'm going to also go about 20 to 30% tension through that moving part. Now, these are really important for one thing, because this helps maintain our joint health. The deepest layers of tissue in each of our joints, like the cartilage, has really poor blood supply. So it relies on daily motion to bring in oxygen and nutrients, everything that it needs to stay healthy. As we go through these positions today, and as you do them in your morning routine or your daily routine, now be aware of how it's feeling. You never want to push through pain, especially the closing angle joint pain. I have another video that talks about that, but basically what that's saying is that if I'm raising my arm over my head, this is the angle that's closing, this is the side that's opening. Now, we can relate that to everything else in the body. Same thing with the hip. If I'm raising the knee, closing angle here as my knee comes closer to my chest, opening on the back side of that joint. Again, we don't want to push through pain. So if you are feeling pain, discomfort, pinch points as we go through some of these positions, you're going to stop short of pushing through that, and you're going to try and work around it. Now, if this is something that's always happening while you're going through your CARs, then I definitely urge you to talk to a specialist, a physical therapist, a functional range conditioning specialist in your area, to really find out what the problem is and solve that. Then you can get back into the routine, continue using your CARs, continue assessing yourself every day as you make improvements. So we'll go through everything today. I'm going to break down each position. I'm going to use some of the more technical terms and then try and describe each one. So go slow to start. I'll have another video that'll be a full follow along that'll be a little faster paced. So let's go ahead and get started. I'm going to walk through each joint, the motions that we're looking for, some common compensations. I'll go through a few reps after that, and then we'll move on joint to joint. In the next video, we'll do the full follow along, both sides of the body. So go ahead, use this time just to learn and practice the motions. So go ahead and stand feet together. We're going to start with the cervical spine or the neck, arms down by your sides, make a fist, and irradiate tension about 20 to 30% through the body. For the neck, we're going to segmentally flex, again, one vertebra at a time, bringing the chin down to the chest as far as you can. Then you're going to rotate to one side, scraping the chin across the collarbone. I'm going to side bend and extend my head back, rotating to the opposite side, side bending back, bringing my chin to the collarbone, and I'm going to rotate all the way through that motion again. So some common compensations are going to be losing control of the shoulders, shrugging them up towards the ears, especially as the head comes down. As I'm rotating to one side, letting the chest or the shoulders rotate and move at the same time. Or when I'm extending back, extending through my upper back or my low back, thinking I'm trying to get more motion. Remember, we're trying to isolate joint by joint. So here's one more rep. And good. Always looking for a good controlled, slow, even pace as we go through each of these motions. Next, we're going to go to the thoracic spine, the upper back. So same position, feet together. I'm just going to cross my arms over my chest. It's going to be the same pattern as the cervical spine. So I'm going to start by segmentally flexing down. I'm going to rotate to one side as far as I can, side bending, dipping my shoulder back, extending all the way around as I'm rotating to the opposite direction. Side bend back to center and rotate. Follow that same pattern here. As you're moving through it, the hips should stay right under you. So this one can be difficult, but as you come forward, we're trying to not let the hips spill backwards. As you rotate to one side, we're not letting the hips rotate with your upper body. And then as you go backwards, we're not letting the hips spill forwards. So I'll go through one more rep from the side here. I'm segmentally flexing down, rotate to one side, side bend, extend, side bend back, and rotate. Really fight to keep that core and those hips solidified throughout the entire motion. From here, we're going to move to the shoulder blades. So there's a few ways that we can do this. We're going to start just feet together, hands by your sides here. I want your hands to kind of remain by your sides, so don't let them go forwards, backwards, or outwards. Keep them here. I'm going to try and draw a large circle, or as big of a circle as I can, with my shoulder blades. I'm going to raise them up towards my ears. I'm going to draw them back towards my spine, dropping them down towards my back pockets, bringing them forward towards my chest, raising them back up, back. So the motions that we're doing here, I'm at the bottom in my back pockets right now. I'm protracting forward, elevating them up towards the ears, retracting them towards the spine, and depressing them back towards my back pockets. Here we'll do both directions. And the most common compensation from this position is just losing that hand position, letting the shoulders start to tip forward, so stay nice and tall, keep that irradiation and stabilize the entire body. Now with the shoulder blades or the scapula, we can also do them forward, we can come out into more of a wide position. There's a lot of different ways that you can work these cars in. So I like to start with my morning routine just in this position. I'll come forward, same thing, protracting, elevating, retracting, depressing, following that same pattern. I'll go through a few controlled reps, I'll change directions, and then I'll even come out to that wide position here, and then same thing. It's going to require a little bit more control, a little bit more practice, but great way to mobilize that shoulder blade in a few different positions. So next we'll move to the shoulder or the glenohumeral joint itself. So we'll start on my right side, left arm's going to be down, making a fist, still irradiating. What I'm going to do first is externally rotate that shoulder, turning my palm outwards as far as I can. Then I'm going to adduct across the midline of my body, bringing it nice and high, trying to bring my arm or my bicep as close to the ear as I can. From here, you're going to hit a sticking point. Once you hit that, you're going to unwind or internally rotate, reaching back behind you as far as you can. Keep internally rotating so when you finish, that pinky is facing forward. From there, you're going to reverse. In internal rotation, you're going to extend backwards as far as you can, staying nice and tall. You'll hit another sticking point here. You're going to start to unwind into external rotation, trying to retrace that same path, bringing the arm back by the ear, across the midline in external rotation with that palm facing up and out. So again, external rotation across the body, coming nice and high, hitting that sticking point, turning into internal rotation, fighting for more as I come all the way through, and reversing from there. Coming all the way back across. So, some common compensations with this. As you come across the body will start to follow, or the trunk will start to follow. So keeping that chest pointing straight forward the entire time. As you come up overhead, you may start Sticking the head forward, extending through the low back to try and get more overhead motion here. As you're reaching back behind you in that internal rotation, don't let the chest follow. So again, keeping that chest forward. And then when I'm extending backwards, a common compensation is letting that shoulder tip forward here. So staying nice and tall, extending back as far as you can, and then starting to open up into external rotation there. Now we're dropping down to the elbow. So I'm gonna start nice and tall, still irradiating. Palm is facing forward, elbow is straight. I'm gonna flex my elbow, bringing the hand towards the shoulder. From here, I'm gonna pronate or turn my palm down, extend the elbow or straighten it, and then open that palm back up, supinate the forearm, and continue through that same arc of motion. We'll go a few reps each direction, and then switch the direction of rotation. So from here, my palm is down, and I'm going to flex the elbow, bring the hand towards the shoulder, open that palm, extend or straighten, and continue on that same path. Now, as you go through this one, try not to let that shoulder do the rotation. This was external rotation or internal rotation of my shoulder here, when really I'm looking for turning that palm down and turning that palm up into supination or pronation down here. And now for the wrist. So we're gonna come into a 90-degree angle at the elbow here. I like to either put my hand over the forearm, or you can even just put a finger right on the edge of the wrist. So we're trying to stabilize and not let that forearm do any of the motion. What I'll start by doing is extending my wrist down. I'm gonna bring it towards the pinky side inwards, creating that rotation as I flex upwards, and then towards the thumb side. So nice, slow, controlled rotation here. Again, we're not letting that forearm rotate as you're going through that motion. You'll go in both directions, and you'll notice that you're gonna get a lot more motion going towards the pinky side than you do the thumb side. And that's just because of the anatomy of our wrist bones. So that's totally normal. But really focus on getting as much flexion coming up and extension coming down as you can. Also keeping the fingers all the way straight. So as I'm coming up or down, I'm not bending or flexing my fingers as I'm going through that motion. So next I'm gonna drop down to the hips. For this, I'm gonna just use something to help with balance. It's gonna be a similar pattern to the shoulder. So I have a dowel here. You can use a wall, really anything. You don't need it if you have pretty good balance, and sometimes if you want to work on that, that's totally fine. But if we want to try and stabilize as best as possible, go ahead and grab yourself a dowel, something to hold on to. I'm going to start with the left hip here. So I'm going to go right arm out, making a fist here. Left hand has some stability here. What I'm going to do first is the same as the shoulder. I'm externally rotating. I'm bringing that foot across my midline. As I come up into flexion, I'm bringing my knee towards my chest as high as I feel like I can. From there, I'm going to abduct outwards. You'll feel like you hit another sticking point here. From here, I'm internally rotating, bringing my foot towards the ceiling and extending back and around. From there, I'm going to extend back as far as I can. I'm going to abduct, bring that knee towards the ceiling, starting to externally rotate, bringing the knee towards my chest and the foot back up as high as I can and down. So internal and external rotation at the hip looks like this. External rotation brings the foot across my midline or inwards, but it turns my hip or my femur outwards. That's why it's called external rotation. Internal rotation is going to be the opposite. My foot is going outwards, the femur is rotating inwards. So as I say that, externally rotate, flex that knee high as you draw it across the midline. We're coming out into abduction, internally rotating and extending behind me, staying nice and tall, kicking back into extension, abducting, and starting to externally rotate all the way back around. So from the side, and a few compensations that you may start to feel, it's staying nice and tall, so we're not letting the pelvis jut out either direction. As you come up into flexion, I'm trying not to fold through my lumbar spine to get closer here. I'm staying tall, so that motion is just at the hip. I'm trying to keep my pelvis level the entire time. So as I come out and around, I'm not letting that pelvis raise up this way to get a bigger arc of motion. So I'm here, hitting that sticking point, internally rotating, extending back behind me. When you're in extension, the tendency is going to be to overarch your low back. So there's a lot of moving components to that one. It takes a lot of practice. But again, we're stabilizing all throughout the body as best as you can and focusing on each component to make it the largest rotation possible. So now I'm going to drop down onto my hands and knees into a quadruped position for a full spinal segmentation drill. So quadruped here, I'm looking to get my hands under my shoulders and my knees under my hips in this position. You can either relax the feet or you can keep them up on your toes, your preference there. So we're going to go through just spinal extension and spinal flexion. The idea is we're segmentally moving one vertebra at a time. So this is extension and this is flexion through the entire spine there. So we'll start down in a fully extended position. My tailbone or my butt is sticking out. I'm in an anterior tilt of the pelvis. We'll go through that in some other videos as well. And then my head is going to be up. I'm going to start with my tailbone. So I'm going to slowly tuck the tailbone down. And thinking about moving one vertebra at a time, I'm flexing up through the low back into the thoracic spine or upper back. And then the head follows at the very end. So I'm in a fully flexed position here, and I'm going to reverse. I'm going to start arching that low back, extending through that lumbar spine, working that extension into the upper back, and the head follows at the very end. So again, the idea is you can envision all of the vertebrae in your spine stacked one on top of another. They should all move independently of each other or have that ability. So picture that in your head as you're creating motion from segment to segment. We'll start often moving from the tailbone, and then you can also reverse directions. So I'm still in that extended position here, and I'm going to start by flexing the chin to the chest, causing flexion through the thoracic spine next, and then all the way down into my low back. And I'll reverse from there, extending through the neck, through the upper back, and down into the low back. Perfect. Next, I'm going to have you go into a seated position. So another good one to add in is actually just more of a passive one. This is for the patellas or the kneecaps. So you're just going to sit, legs straight. Now the patella should have a good amount of motion or the ability to move downwards, upwards, side to side. So these patellar glides. So we're just going to help that by going in a large arc or a large rotation. You can just use your fingertips to guide it each direction. Right now I'm pushing inwards, working my fingers around. I'm going to start bringing it upwards as I trace that patella. Now I'm pushing outwards and down. So again, it's just good to get that patella moving, assessing, making sure that it has the available motion. A lot of times after injuries or surgeries, this can get bound down, which can impact the mobility in your hips and ankles as well, along with the knee. And next, we're going to still stick with the knee. We're going to go through some tibial rotations with flexion and extension of the knee joint, which just means that the knee joint can bend and the knee joint can straighten. There's also rotation that happens in that knee joint. So if you look at my shin bone here, I can rotate or internally rotate here, and I can externally rotate, keeping my knee pointed straight towards the ceiling. I'm just turning that lower leg in and out, which is causing rotation within my knee joint. This is how healthy knees should move. So we're going to practice that with our controlled articular rotation. You're going to go arms under the leg just to create some space off of the ground. What I'll start off by doing is either direction, I'll internally rotate. I'm going to flex or bend that knee as far as I can, go into external rotation, and then start to straighten it from there. I'm going to reverse, maintaining external rotation, bending as far as I can, internally rotating it, and extending. Back and forth here. Nice and controlled. Again, really using that tibia, that shin bone as your point of reference for the rotation that's happening in the joint itself. Now, common compensations are going to be hip movement or too much ankle motion as you're trying to rotate. So the ankle, you can even pull the toes or the top of the foot towards the shin to stabilize it more, and then really get that rotation through the knee joint. And then again, if I'm rotating out and my hip is rotating, my knee is going to start pointing in different directions. Try and maintain that knee pointed straight up towards the ceiling as you go through those. And now down to the ankle itself. So we can stay in that same position, arms under the leg. I'm going to draw as big of a circle with my ankle that I can. So I'll go through the motions right now. I'm inverting, turning the bottom of my foot inwards or towards my midline. I'm plantar flexing, pointing my toes like I'm pushing the gas pedal. I'm everting, trying to turn the bottom of my foot outwards. And I'm dorsiflexing, pulling the top of my foot or toes towards my shin. Now you don't need to memorize all of that, but go through the largest arc of motion that you can with that ankle. Everyone likes to speed through these ones. Take your time, nice and controlled. Let your body get that feedback from the nerve receptors in the ankle joint. And then you're going to go ahead and switch directions. Common compensations are going to be getting a lot of rotation through that lower leg. There's going to be some that happens, but again, we're trying to irradiate and stabilize as best as you can. And then also moving of the hip or the knee. So everything should remain still as the ankle goes through its controlled articular rotation. And last couple here, we're going to talk about the toes and the fingers. Now the toes, they can be kind of frustrating and something that we often don't think about. But again, each joint down there, we want to be able to move and have good control of. So I'm going to stand, feet about hip width apart, still irradiate tension. And what I'll start off by doing is trying to keep my 4 smaller toes planted to the ground. I'm going to lift my big toe up off of the ground. I'm going to lift it up, flex it, and then bring it down. It's actually extension as that toe lifts up, flexion as it comes back down towards the ground. From there, now I'm going to glue my big toe to the ground, and I'm going to try and lift or extend the 4 smaller toes up. Okay, from here, we're going to extend all the toes, lift them up off of the floor, keeping the 4 smaller toes up. You're going to try and tap the floor with the big toe. And if you guessed it, now keep the big toe up, tap the floor with the 4 smaller toes. These are challenging. And good. Last one, think about playing the piano. You're going to drop the pinky toe first, then the 4th, the 3rd, the 2nd, and the 1st, the big toe. Bring them on up. And again, try and drop them one at a time. See where your control of your toes is. Now there's a lot of drills that we can do to help improve that, but that's a good way to just kind of wake up or in your daily routine, get those toes moving. The big toe especially really should have a healthy or good amount of extension. Every time we take a step off of that foot, it should be able to raise up. So that's a really important one. If you notice you're really lacking that motion, that's something that you'll want to start working on. The last part, fingers and hands. Now, there's different ways that you can do this. I just spend a little bit of time. I'll go through some finger flexion, making a fist, extension, opening them back up. Now for me, as a jiu-jitsu athlete, my fingers kind of get beat up a lot, training in the gi, grabbing onto things. So I always find this really important every day and before I do my training to get those fingers moving. You can go those directions. You can do rotations of each finger. An easy way to do that too is if you were to put your hand on a desk or a table and you can isolate one by one, going through those rotations at each finger. And again, just trying to isolate joint by joint, seeing how you can control your own body. So we just finished up going through and explaining all of our controlled articular rotations. Now try and make it a habit. Do these every day. That's why it's called the morning routine. I spend 10, 15 minutes, grab some coffee, tea, just want some caffeine in my life, and then getting my body moving. Spending that time to get each joint moving, I'm looking to help maintain my joint health over time, and I know it'll help with yours as well. Those joints need motion to stay healthy, and this is a great way to really explore how your body's moving, see what weak points you may have, and work on them as time goes on. As you build that control up and that body awareness, you'll start to feel some of those changes and really reap the benefits in it. If you have any questions, go ahead and reach out to me, and then I'll have another video walking through the routine, a little faster paced, a little less talking, and that'll actually look more like the morning routine or what I do to warm up.